Good morning, everyone. Today I would like to present on the safe use of high alert medications, HAM. So introduction, high alert medication, HAMs, are defined as medications that bear a heightened risk of causing significant patient harm when these medications are used in error. So these are the few categories of HAM. As you can see, there are adrenergic agonists and antagonists, anesthetic agent, antiarrhythmic, antithrombotic agent, antivenom, chemotherapy, paranutrition preparation, epidural, opioids, immunosuppressant agents, inotropic medication, sodium chloride for injection, or dextrose, hypertonic, which is 20% or greater, GTN injection, magnesium sulfate injection, potassium salt injection, moderate and minimal sedation agent, and also neuromuscular blocking agent. So next, we go to the list of potential harm. The first one is potassium chloride injection. So the common type of errors is incorrect drug or drug preparation error. So the common risk factors, the potassium chloride injection and dextrose 50% were stored next to each other in the medication shelf, and also incorrect preparation of medication. So the recommendation of improvement strategies is develop a clear guideline or SOP of usage, ensure a complete prescribing information which specify the total dose, route, volume of dilution, and rate of infusion, counter check before the preparation, dispensing, and administration, add a cautionary label, and choose a designated area of or container for storage. Next is second one is a lignocaine, which is lidocaine hydrochloride injection. So the common type of errors are incorrect drug and route of administration. Then the common risk factors include the confusion of different strength or multiple formulation and medication preparation, confusion of different route of administration, example IV versus IM, and also the indication. So the recommendation of improvement strategies include keep an up-to-date list of all available formulation, generic name, trade name, available strengths. Then ensure an appropriate medication preparation, dilution, dosage, and rate of administration. Read the label or package insert before reconstitution or dilution. Perform an independent counter check and add an auxiliary label when appropriate. The third one is insulin. So the common type of errors are incorrect dose and type of insulin or brand. Then incorrect injecting devices, which is due to the brand variation given to the patient. So the common risk factors are look alike, sound alike medication. For example, Mistad versus Insulatard, Insugen N versus Insugen R. And then the availability of multiple brands of insulin, use of abbreviation U for units mistaken with 0, storage of insulin medication next to each other. So the recommendation of improvement strategies is keep an up-to-date list of available insulin and injection that available in the facility. Perform a counter check before dispensing and administer insulin. Spell out the word of units instead of U, and add a cautionary label to differentiate the type of insulin. The fourth one is the enoxaparin, fondaparinux, warfarin, and heparin. So the common type of errors are due to incorrect dose and frequency, prescribe or supply fondaparinux instead of enoxaparins, then incorrect labeling of dose, for example like warfarin. So the common risk factors is because of confusion with dosing regimen, dosage prescribed is not based on patient's weight, inaccurate renal dose adjustment, lookalike packaging like 40 mg versus 60 mg, availability of multiple strength such as warfarin or heparin. So the recommendation of improvement strategies, keep an up-to-date list of available strength of this medication, Standardize concentration or strength available anticoagulant. Standardize the baseline information such as weight and renal function. Use stall monitoring and store look-alike medication separately. Emphasize on patient counseling or education and using a cautionary label. Next is chloral hydrate mixture. So the common type of error include the incorrect dose and incorrect route of administration. So the common risk factors: prescribe or administer incorrect dose due to inaccurate body weight or incorrect calculation, supply incorrect strength, and administer IV instead of orally. So the recommendation of improvement strategies include clearly label the medication. Use of oral shrink may help to reduce incorrect route of administration of an oral medication into a vein. Counter check before administration. Should only be given by healthcare personnel, not by patient or caregiver unless under special supervision. Next is noradrenaline and adrenaline. So the common type of errors include incorrect infusion rate, especially for NOAD, and then incorrect dose and drug. The common risk factors include inexperienced personnel, inadequate knowledge on NOAD calculation, inaccurate dose prescribed, and also look-alike, sound-alike medication, NOAD versus adrenaline. So the recommendation of improvement strategies include all personnel shall be trained prior to handling NOAD or adrenaline injection. Prescribers must have proficient knowledge on the dose and potential side effects. Specify the dose, route, and rate of infusion on the prescription. The correct medication dose, route, and rate of infusion should be counter-checked before administration, and then using a cautionary label. Next is the common risk factors associated with harm. So first is different route of administration. It is happened because of the confusion between IM, IV, intrathecal, or epidural preparations. Second one is the misinterpretation of medications order. Use of abbreviation U for units mistaken with 0 and result in tenfold overdosage. Then use trailing zeros using and result in tenfold overdose. The third one is incorrect preparation of drug. For example, incorrect dilution, incorrect diluent, incorrect dose or strength of drug, and also incorrect calculation. The fourth one, wrong infusion rate. It happen when wrongly prescribed or miscalculation infusion rate. An incorrect infusion rate may be programmed on the infusion pump. The fifth is look-alike, sound-alike, LASA. It happens when look-alike or sound-alike product and similar packaging. Then the availability of product variation happen because of confusion of different strengths, multiple formulations, brands, or colors of the same drug. And then the ambiguous labeling, unclear concentration and total volume information on the container or shrink label. So these are the management of harm. So first is disseminate list of harm to all healthcare personnel in the facility, and then have a high alert medication labels on the storage shelf, container, product package or loose vial or ampoules. Use either harm sticker or label ataupun harm envelope. Inform any changes of brand, color, preparation of harm to the user. The medication is identified as high alert shall be targeted for specific error prevention strategies. Next is review and evaluate the checklist of harm. And then harm will be prescribed, dispensed, and administered using practice that are proven safe. Harm also must be counter-checked before prepared, dispensed, and administered to the patient. One healthcare prepare the medication and another person counter-check. Okay. All harm issued from the pharmacy must be counter-checked and verified by another pharmacy staff before dispensing. All equipment or devices used in preparation and administration of medication shall be calibrated and maintained according to SOP. And then identify and keep apart look alike, sound alike of harm. Identify list of harm used within the facilities. Monitor and report ADR and medication error related to harm. Utilize safety control when appropriate. For example, use of oral shrink for oral medication or computerized system. That's all. Thank you.